living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many people who get COVID-19 recover in a few weeks, but some people, even those with mild symptoms, are still suffering months later. Welcome to Healthy Living for Life, show dedicated to helping you do just that. I'm Sara Medley, your host. Today we're going to be learning about post-COVID-19 syndrome and why some long haulers have trouble shaking it. Stay tuned. Welcome back to Healthy Living for Life. Joining me today is Dr. Doug Kuntzweiler, Chief Medical Officer of Mountain Pacific Quality Health. Thanks so much for being here.
Thanks for having me.
We always appreciate it. We know COVID-19 doesn't affect everyone the same way. I mean, we've read about all that, and some folks get really sick and some folks are not sick. So talk to us about why is that?
Well, we don't know for certain, but all of the evidence so far seems to point to an overreaction of the body's immune system. And I'll give you an analogy. It's as if a policeman were called to a bank robbery, and he goes in and he begins shooting indiscriminately. Yes, he kills the robber, but he also kills a lot of innocent people who aren't involved. Our immune system has sometimes the ability to do the same thing, to go awry and attack our own tissues. And the people who get the sickest with COVID, that seems to be what's going on. They're having a very fulminant immune response that is damaging their own tissue.
So we've also read about people who have serious risks, not necessarily associated with COVID, but talk to us about the risks that really impact the severity of the symptoms.
Yeah. Most people who have COVID have a fairly mild course, probably 80%. But then there's about 20% of people who get quite ill, and that can happen in just a matter of a couple of days, going from very mild symptoms to being severely ill. The people who seem to be at the highest risk for that, first of all, are older folks are more prone to that. And then people with chronic illnesses, especially chronic lung disease like asthma, COPD, smokers are likely to have more trouble. People with some form of chronic heart disease, especially congestive heart failure, are more prone to have that. Obesity is a risk factor for it. Pregnancy, we've learned, turns out to be a risk factor for having a more severe form of the disease. So there are quite a few chronic illnesses and other conditions that can make you more likely to get quite ill. So
if we read the statistics, the percentage of people who die from COVID is relatively small. Mm-hmm. Though if it's a loved one that died, it doesn't matter, right?
Right.
So talk to us about that fact. There are very few people.
Yeah, the mortality rate is somewhere around 1 to 2%, which you can read that and say, well, that's trivial. What are we all excited about? But when you realize how widespread COVID is, and you take, let's say, the American population, around 330 million people, if 1% die, that's 3.3 million people. So the numbers look different when you look at it that way.
So let's talk about the lucky people that get COVID-19 and they have very minor symptoms, really. Talk about how those symptoms, though, have changed since we first started experiencing COVID at the end of 19.
Yeah, when COVID first came around, fever and cough and loss of smell and taste were kind of the hallmarks of it. And people were noticing chilblain-like lesions on their toes and on their fingers as well. And as time has gone on and the virus has changed a little bit, those presenting symptoms have changed a little. Fever is not as common as it was. People are more likely now to complain of headache, sore throat and a runny nose. It almost appears milder initially. Of course, it still turns out to be a very bad disease, but the symptoms have changed a little over time.
Well, we've been dealing with COVID, obviously, a long time now, so that's clear. Now we're hearing about long haulers and what that is causing and folks having experiences with it. So talk to us about the subject matter today, which is that post-COVID-19 syndrome.
Right from the start, it was clear that there were some people who were getting over this fairly quickly in a matter of a couple of weeks, and then there were other people who were having symptoms that persisted. Initially, loss of taste and loss of smell especially seemed to be common. But now, as time has gone on and we've gotten more experience, it's quite clear that there are some people, maybe 10 to 20% of everybody who gets COVID, who wind up with long-term symptoms. The World Health Organization just decided that the definition of long hauler would be anybody who's had symptoms for 2 months, 8 weeks or more. If your symptoms persist beyond that, then you're considered to have long haul syndrome.
Do we know what's causing these long-term symptoms?
Well, again, the blame seems to be on our body's immune system. It's going to take more study and more time to figure all of this out, but it looks like people's immune systems are activated, and then it just doesn't completely ever calm down again, and that's what's going on in the long haulers. So they have immune systems that are releasing chemicals that are attacking their own body.
So we'll talk about some details of what COVID-19 and long haul symptoms are doing to organs and whatnot. But what are the most common symptoms of a long hauler?
Yeah, they tend to vary a little bit. In males, it's mostly shortness of breath and chest pain. Females, it's mostly fatigue and headache. Now, obviously, you can have any assortment of that, but fatigue is a big one. Diffuse muscle and joint pain is a common one. Cough, shortness of breath.
So a question I hadn't really thought of, is there any data between COVID-19 originally and then a breakthrough case and the long hauler issues for a breakthrough COVID case once you've been vaccinated?
Yeah, there's not a lot of data yet because, again, we just are sort of finishing up getting the initial round of people vaccinated and getting them their boosters. So we don't have a lot of data, but it's quite clear that it can happen to breakthrough. If you are immunized, you are less likely to have it, maybe by as much as a third. But if you had COVID, got over it, you catch COVID again, you've got a chance of getting long hauler syndrome at that point. If you got immunized and got it, there's about a chance 2 out of 3 that you might wind up with long haulers.
Wow. Frightening, it really is.
It is frightening.
Very frightening. So what about the Delta variant and the early COVID-19 that we all knew about early in 2020? Is there a difference in the appearance of long hauler between the Delta variant and regular COVID?
Yeah, so far probably not much. The main difference is that the Delta is more easily spread than the initial COVID that we were dealing with. It doesn't seem to be any more deadly, and I don't think it's associated with long haulers any more than the original was.
Thank you so much. We need to take a break, and don't go away. We've got more information on COVID-19 and long haulers. We're still talking with Dr. Doug Kuntzweiler about long hauler syndrome and COVID. So thank you so much for sharing your information.
Thanks for having me.
All right, we've talked a bit about the long haul syndromes. So talk to us about damage that's done potentially to organs, heart, lung, kidney.
Yeah, lungs seem to be one of the primary problems. The COVID virus attaches to the lining of the lung, on the inside lining of the lung, and sets off this inflammatory response, and it actually breaks down those cells. They break open and they start leaking fluid into the little air sacs that we use to breathe, and people essentially drown in their own body fluids. If they survive it, then that area scars, and so they forever then have a reduced lung capacity. And as you know, people have even gotten lung transplants in order to try to save their lives when they've had a really bad situation with this.
So when I'm thinking about the lung damage, would that impact someone very similarly as congestive heart failure, for example, or other conditions or diseases?
It is. In some ways, it's similar to congestive heart failure. It's actually a little bit worse because of the cell destruction. In congestive heart failure, you have fluid leaking from the lungs because the heart isn't pumping efficiently enough. In the case of COVID, you've got actual damage to the cells of the lungs, so it's a little bit worse.
What are we seeing with the heart?
So there are a couple things that can happen with the heart. One is the virus can affect the heart muscle directly, and that's called myocarditis. That can cause the heart to not pump efficiently. That can lead to congestive failure. It can also cause rhythm disturbances that can be troublesome. The other thing that happens with COVID is it seems to promote blood clotting, especially in small blood vessels. So we've seen people have clots in their coronary arteries, which leads to a heart attack. And we've seen that happen in the brain. People have had strokes as a result of COVID. So altogether, quite unpleasant.
And kidneys.
Kidneys, it can affect kidneys very much in the same way. It can cause the kidneys to become inflamed, and it can also cause clotting in the kidneys. It can cause an autoimmune response where, again, the body reacts to its own tissue and damages the kidneys.
Yeah, it's just frightening, again.
It is.
So aside from the organs, obviously vital organs, I'm also hearing about the loss of sense of smell and taste, which is also, maybe minor, but certainly unpleasant.
Well, it seems trivial until you talk to somebody who's had it happen to them, and it's actually quite profound. They lose weight, they lose half of the enjoyment of life, and it's actually quite a disability.
What about the chance of getting that back? So are they tracking it, and is it you're losing your sense of taste and smell for a few months, and then at the 6-month mark you'll get it back?
Yeah.
Is that not the case?
Well, to some extent we don't know yet because it's still relatively early. Most people regain it within about 3 to 6 months, which 6 months is still a pretty long time. There are people who are 12 months out. In China, there are people who are 18 months out and still have not recovered the sense of smell and taste. So we don't know for sure. We can't say it's permanent, but it's looking like some people are going to go quite a long time in this condition.
So we've talked a lot about those over 65 for sure, because we were all at risk of COVID significantly, but I'm really worried about the teens and the younger kids, certainly. So what are we seeing with them in terms of long haulers? Yeah,
initially we weren't very much worried about children because in those first few months it looked like they weren't much bothered by it. Now that we have more experience, and particularly with the Delta variant, we're seeing younger folks getting quite ill, being hospitalized, and we're starting to see younger folks have long-haul symptoms, and we're seeing younger folks die, unfortunately.
What are our clinicians doing to treat long haulers? Clearly it depends on what it's affecting.
Yeah, we don't really know exactly what to do. Monoclonal antibodies are being used with some success. We do know that if you get the vaccine, if you get immunized, that seems to help to modify those symptoms. There are some new antiviral drugs that are being developed that are showing promise, but we're a ways away yet from knowing exactly how best to treat these symptoms.
I think I know your answer to this, but in about the 30 seconds we have left, can long-term COVID-19 be prevented?
Well, the vaccine can prevent it, we believe. And the other weapons we have, masking, washing hands, socially distancing, stay home if you're sick, all those things can help prevent it because they help to prevent you from getting it in the first place.
I thought that would be your answer, and it's a good one. So thank you so much for joining us. And viewers, don't go away. When we come back, we're going to be talking about the mental health significance on folks who have had COVID, dealing with long haulers, and are just worried. So stay tuned. Welcome back to Healthy Living for Life. Joining us now is neuropsychologist Dr. Loretta Bolyard. She's going to talk to us about what she is seeing as far as neuropsychiatric impacts of COVID. Thank you so much, Doctor, for being with us. We sure appreciate it.
Thank you for having me.
We know a common symptom reported by folks with COVID-19 is brain fog, so we've all heard about that. Can you describe what patients are experiencing?
Yeah, so I would say that about 25% of individuals who have suffered from COVID-19 are showing cognitive difficulties, which we've been referring to as brain fog. And this brain fog can persist for weeks to even months. And what patients really are describing for this brain fog is low energy, problems with concentrating, problems focusing, short-term memory deficits, feeling disoriented, and then having word-finding problems.
Well, what causes that brain fog?
Well, we really are thinking that the symptoms arise from various neurological complications, including things like inflammation in the brain, autoimmune responses, actual brain damage and cell death from COVID-19 related to oxygen deprivation or the systemic infection, small brain bleeds, and then also even strokes related to COVID-19.
Is the specific brain fog related more to those folks who had severe symptoms of COVID-19?
No, actually in the beginning, initially we thought that patients who were seriously ill or required lengthy hospitalizations or who had been on ventilators, that those were the individuals who were suffering from brain fog. But we are starting to see more and more individuals who had milder cases of COVID-19 and who were not actually hospitalized.
That is frightening, very frightening.
Yes.
So when I think about brain fog, help me kind of mark this in my mind about how significant it is. Are there folks that you've seen who are not able to work because of brain fog?
Yes, I have seen people very functionally impaired from COVID-19 and the brain fog.
So literally they have to quit their job, go on unemployment,
Yes.
etc. Wow.
Yes.
So what about certain types of people? Are they more susceptible to the brain fog than others?
Yeah, so it appears that older adults are more susceptible to getting the brain fog, and then also those individuals who have pre-existing health conditions such as respiratory issues or diabetes, obesity, cancer, cerebral vascular disease. And then also it seems as though women are more susceptible, and then those individuals who had pre-existing depression and anxiety are at greater risk.
So what other symptoms are we seeing as a result of neurological complications?
Some of the other neurological complications would include things like headaches, fatigue, dizziness, balance issues, tremors, numbness and tingling, blurred vision, and then ongoing loss of taste and smell or diminished.
So what about gastrointestinal symptoms?
Yes, we are also seeing gastrointestinal symptoms, and while that may not be related to the actual neurological implications, we certainly are seeing folks with prolonged nausea, diarrhea, abdominal pain, etc.
Wow. What is your understanding around whether or not persons have an increased risk for developing dementia or even Parkinson's?
Yeah, I'm really glad that you asked this question. This is a particular area of interest to me. And what we are seeing is that older adults who develop COVID-19 seem to have elevated levels of certain proteins and biomarkers in their blood that are indicators of brain injury that we typically only see in dementia, and particularly dementia of the Alzheimer's type. And so given these findings, there's concern that we could be seeing a surge in dementia across the next year or a couple of years above and beyond what we would expect for our aging population.
Oh, that is so frightening. My goodness.
Yes, it is frightening.
So there are also reports of folks who have gotten sick with COVID-19 and are now experiencing significant depression and some behavioral health issues. Are those neurological effects?
Well, I think this is a rather complicated question. We're certainly seeing patients who develop things like depression, anxiety, and even post-traumatic stress disorder following COVID-19. And while the cause of these mood symptoms could certainly be related to the direct effects that are occurring within the nervous system, there are also a number of other factors that could be leading to mood difficulties. And these include things like the trauma from being hospitalized, the loss of one's job, worrying about their finances in the future, also social isolation, which comes with marital difficulties or difficulties with parenting. And then we also see an increase in alcohol and drug use, which would certainly be exacerbating any kind of underlying or new mood disorders. And so it's really a complicated situation for folks.
So we've got about 45 seconds left. So any final thoughts that you have that you really want to make sure our viewers take away and hear today?
Yeah, I think it's really important that we be addressing symptoms from a biopsychosocial model or a multi-systems approach. It's important. We need to be managing symptoms from several perspectives that include not only the physical symptoms, but also the brain fog, the depression, the anxiety, the social stressors, et cetera, and encouraging folks to get vaccinated and to socially distance.
Oh, thank you so much, Dr. Bolyard. That time went really fast. And
thank you.
I'd also like to thank Dr. Kuntzweiler for joining us and sharing great information, though frightening information. So may I just say, if you haven't been vaccinated, get vaccinated. We hope you'll come back, though, and join us next week. And until then, stay fit, stay well, stay healthy with life, with Healthy Living for Life. Take care, everybody.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.